Joining us this morning, our friends from Titusville Area Hospital. And, Lee Clinton, the president and CEO of the hospital, is with us. And we're along Dr. Matthews. We'll talk to Dr. Matthews in just a moment. But good to see you this morning. And lot of exciting news hitting Northwest Pennsylvania. Do you want to kind of start with what you can tell us?
Sure. I'll leave most of the medical advice to Dr. Matthews. Although I did stay at a Holiday Inn Express last night.
Nice.
But yeah, I think we're probably primarily going to be talking about coronavirus, its surgence here in Northwest Pennsylvania, the vaccine, and things of that nature. So,
did you see? Because there's still a lot of people that are obviously questioning this. Are you seeing a big difference from spring to now?
Absolutely, 100%. I guess my position on it, which is one person's opinion, you know, when everything was shut down in the state and you know, the economy kind of took a hit, you know, we really didn't have any coronavirus here in March, April, May. You know, it was in New York City and some of these. We really didn't have it here, and so I don't know if that affected the way that people are behaving now, if they think it's kind of the same, but it is absolutely positively here. The hospitals are full. We in Titusville have had, you know, between 8 and 12 COVID positive inpatients at all times for at least the last month. You know, Meadville has 30 or so at any given time, and you know, Hammett and St. Vincent and Erie are packed. Positive rates are up. You know, there's been, it's been at least a week since I've seen the stats, but I think there's been at least 40 deaths in Crawford County from COVID. I mean, it is, I don't believe it was in Crawford County in March and April or anything to speak of. It's absolutely here now. I think people need...
We're not talking like 1 or 2 night stays in the hospital. We're talking weeks sometimes.
Right. Well, there are people that pass away from it, and that's, you know, that's the weird thing about it. It's not always just the people that are 99 years old, and you say, well, they were on the verge anyway, and that was just the thing that tipped them over. I mean, there are cases of younger people that are getting really sick and hospitalized, and it's, you know, the scary part about it is if you get it, you don't know if you're going to be the 90 some odd percent that gets over it, or if you're going to be in the lower percentage that gets really ill from it and gets hospitalized. So that's, at least from a personal perspective, that's kind of scary.
Let's head over to Dr. Matthews. Welcome back.
Thank you.
Good to see you.
Good to see you.
Before we get into the vaccine part, let's kind of catch up because it's been a couple months since we last saw you. How have things been going? And I'm sure this has been a pretty busy time for you.
Going really well. Yeah, the last time I saw you, I think I was brand new.
Yeah.
First week or two here. I think I'm settling in very well. Been excited to see patients and excited to be in this community. Everybody's been really wonderful.
That's great.
But it's been a crazy time in healthcare. So
yeah. So what's going on? I guess on your side of things, how have things, you know, gotten crazy, and what are some good things that are coming up, and what are some things we still need to kind of watch out for?
So, you know, pertaining to coronavirus, obviously, yeah, when I came in the summer, the numbers, you know, were non-existent. But with this surge that the rest of the country is having, we've definitely been affected. I've been on our hospital's coronavirus task force, and I've been very impressed at the things that our small hospital have been able to achieve, and really pleasantly surprised and very proud of everybody. We are, as Lee said, we are treating coronavirus patients at our hospital. We do have, you know, the treatments that are available. You know, so we have the remdesivir, we have the steroid, we also have convalescent plasma, and that's available. Wow. And our physicians have been really working hard, our nurses, our ICU nurses, everybody. has been working hard to keep to help people, and it's not a big scientific study, but the doctors have been saying that especially the convalescent plasma has been helping their patients.
That's wonderful. What was the feeling like when the first deliveries for the vaccine came? I mean, that had to have been...
Oh, wow. It was amazing. They came yesterday, and we've known we were approved for about 2 weeks, and we've known for sure when the FDA said, yeah. So it was a very exciting time. As Lee said, there's finally a light at the end of the tunnel that perhaps we can get back to normal life. It's going to take a while because it's going to take a while to roll out the vaccine to enough people to achieve that herd immunity that we talk about. But at least we're heading in the right direction. It's a very exciting time in science. Yeah.
So if you watch the news, a lot of people have been watching the news just to see what's going to happen. And there's sort of various tiers on how the vaccine is going to be rolled out. Now, the one you received, this is the part 1 of 2 that will be needed?
Yes.
Okay.
Yes. So the vaccine that has been approved is the Pfizer vaccine, so that's the only one out in the United States right now. The Moderna one will be coming up. Hopefully, we expect that to be passed in the next couple of weeks, I believe. But we have the Pfizer vaccine here, and it's a two-shot series, 21 days apart. So basically 3 weeks apart.
Okay.
Yeah.
And it's important that people come back to get that second shot.
Absolutely. That first shot is it's a primer, basically. So it kind of primes your immune system. It starts making antibodies. That second shot is where you really get the long-lasting immunity.
Okay. So the various tiers, who gets the first round of shots, and then who's sort of next on the line, down the line? Do you know yet?
Yes. So the first tier, or the first phase, is 1A, and that's what we have enough vaccine for right now, and that is going to focus on healthcare workers, skilled nursing facilities, and our very, very most vulnerable elderly populations in there. For our hospital, we pretty much anybody who works in direct care with patients will be able to get the vaccine. So that includes doctors and nurses, but it also includes the people that clean. Oh man, they're putting their lives on the line every day. So it's people that clean, the food service, anybody who's in contact with patients. And then also, we will be rolling out other people in the community that also do patient care. So, for example, emergency services, fire, police, one of the home health agencies, chiropractors, dentists, anybody who has direct face-to-face can't stay home.
Right.
And so those people, those businesses have already been notified, and we're going to have a list, and we'll roll out that list for whoever will take that vaccine.
It seems like Lee was talking about that light at the end of the tunnel. It seems like it's gotten really bright over the last couple of weeks. Like there's a lot of, and I don't mean this to sound like there should be no caution with all of this, but if, like Dr. Fauci and others, it's been a lot more positive over the last couple of weeks than it was a month or two ago.
Well, it's kind of bittersweet. It's bitter because obviously we are in the crisis right now, and that's not going to go away because 1 million people got shots. So we're still dealing with that, but I think the world needs hope right now, and I think this vaccine gives us hope, and it gives us real concrete move in the right direction, and I think it's wonderful. And the the scientists that have been working on this, the people that have been working on the vaccine, it's just amazing what they've been able to do. And there are several reasons for that. One is because all this technology was already developed. So they had been working on this vaccine for MERS and SARS and Zika virus. But those didn't pan out to be big enough pandemics for them to really get the funding. The governments around the world have been incredible at funding, and so that's the other thing. These companies, not only did they already have the technology, but they had the funding to roll it out really quickly.
Yeah.
So a lot of people are really like, oh my gosh, it happened so fast. It must be, snake oil. But no, that, it was good science to begin with, and it's just amazing what they've been able to do.
Not that there's anything wrong with snake oil. I still use it from time to time. You're watching The Morning Drill on Stream Television and on Armstrong's Neighborhood Channel and listening to it on the Allegheny News Talk Sports Network. Lee Clinton, Dr. Matthews with us here. That's going to be the other part of this, right? When it is available to the public, there's got to be some trust with that. And I know there's going to be campaigns running constantly saying how safe this is. You practice family medicine.
Yes.
You're going to be talking to families. I'm sure this will be, a concern to some families that are coming to you saying, is this safe? Should the whole family get it? There will be those types of questions, won't there?
Absolutely. And there are. And I think people are right to ask those questions. I think, this warp speed thing, I mean, it was warp speed, and some people don't like warp speed. They're more comfortable with other speeds.
Unless it's fast food. Then
yeah, exactly. Unless it's McDonald's.
Yeah.
But, so I think people are right to question it. But I have sat down because I didn't know whether I was going to get the immunization. And I sat down and did a lot of research and looked a lot of places and read the studies. And I really feel that it's very safe technology. It's technology that hasn't been used widely, but it actually creates better immunity than the immunizations we have now. And it works.
Well, you're seeing that with 94%, 95%.
Amazing.
Yeah.
It creates better immunity, and it also is a technology that's safer than some of these, killed viruses we have. So it cannot cause illness. Now, it's going to cause an immune response, so, your arm's going to hurt and you're going to get achy and maybe a little fever after your second dose. But really, they have done large trials as large as some of the other immunizations, most of the other immunizations that have been passed. Wow. And so, on the 40,000 people have already taken this vaccine. And overall, it's been very low rate of side effects.
Well, and time has been flying, and I think if people recall, the first trials went back in spring. I mean, they've been working on this for a while, so it's not one of those things where it just happened 2 weeks ago and like, oh, here it is. There's been stories on that. Lee, when you look back at 2020, what are you most proud of with the hospital and the staff?
Well, 2020 has been a real challenge, but lately, like Dr. Matthews mentioned, the light at the end of the tunnel. But seeing the people come together, I mean, we've got some really great people that work at the hospital. We've had this kind of incident command structure set up with COVID, the COVID task force that Dr. Matthews mentioned that, we've been meeting multiple times a week for many months. And at first it was, when it wasn't here, it was planning, what are we gonna do? And then, unfortunately we had to put those plans into action because it's here and running rampant. And, I don't know if anybody believes me any more than they believe anybody else, but you can take my word for it. It's here and it's serious, and if you have the opportunity to wear a mask or not wear a mask, which everybody makes that personal choice every day, wear a mask. It's really important, and I can't express how disappointed I am when I go places like Walmart or Sheetz or wherever around town and I see a relatively big percentage not wearing masks. It's really, it's just disappointing. So, we wear our masks religiously, not only to practice what we preach, but it's protecting other people. But proud of the folks at the hospital. We're ready to go. We've gotten all these treatments at our local hospital. I believe we're one of the first, maybe the first hospital in Northwest Pennsylvania to get the vaccine, and that's because we were prepared. I believe some of the other hospitals in Erie and Meadville are slated to get it on Thursday. So not a big difference between Tuesday and Thursday, but we've got a lot of resources for a small community hospital, and it's for no lack of planning.
There's certainly a lot to be proud of. I was watching Don Roten's interview on the COVID Facebook page the other day. He was talking to one of the doctors, and he started to mention, just all the different departments involved. And you mentioned the cleaning. There's so many people that go into keeping the hospital safe and the staff and the patients safe. It really is incredible, and nod to everybody at both hospitals for everything that they've done to not only help those in the community, but of course keep their employees safe. So, congratulations on all that, Dr. Matthews. You've come into this hospital setting. That must make you proud to say, "Boy, you know what? This was a good choice coming here."
Yes, again, I've been so impressed. I came from a very small hospital in Colorado, who was also on the ball. I think they're doing okay now, but yeah, I've been really impressed, and really there's such a great sense of community, and the people at the hospital, from administration to nursing, they just love this community and want to see people healthy and safe.
All right, we'll get final thoughts here, Dr. Matthews. Of course, as the vaccine is starting to roll out, what do you tell your patients? And if somebody's looking for a doctor, you're open to accepting new patients. So there's that. You can call the hospital for more information. But what do you tell the folks that come in and see you?
About the vaccine?
Just about life in general right now and the vaccine.
Yeah, I tell them to be careful, to wear their mask. The holidays are so difficult, and we all want to be with our families, and we miss them terribly because we haven't been able to see them. But I tell them to be safe, to not have large gatherings. If you're going to gather, make it outside or make it short. Make sure you can social distance. A lot of people are not going to be able to do that, but it's really important as Christmas rolls around. And then also when the vaccine is available to their age and risk group, please take the vaccine. I'm an experiment. I'll tell you if I have any bad reactions or not. But really, the trials tell us that it's very safe, and it's really going to get us over this hump and get us back to normal life.
Lee, thank you for allowing folks to come in and join us throughout the year. We look forward to 2021, and I'm sure there's a lot to look forward to in the new year.
Thanks, Luke.
All right, thank you, guys. Dr. Matthews, great to see you again. Thank you so much, and thanks for joining us here this morning. Morning Drill will be back tomorrow morning on Stream Television. Armstrong and the Allegheny News Talk Sports Network.